Hello, and welcome to Demystifying Medicine, where today we will be looking at the mechanisms of aspirin. Let's start off with what aspirin is and what it is used for. Aspirin is one of the most commonly used medications used to provide relief from minor aches and pains, reduce fever, and reduce inflammation. One of its most common uses, and the one we will be going into depth today, is aspirin's antithrombotic ability, or the property that causes it to be a blood thinner and prevents blood clots from forming in the body. In emergency situations, aspirin can be the drug that saves a life or puts it in more danger. Today, we are going to be discussing how aspirin can act in both of these roles. The discovery and the use of aspirin dates back centuries, although in a very different form to what we know today. Aspirin first started as bark from a willow tree, known for its ability to act as a painkiller and as an anti-inflammatory agent. Willow bark was used by ancient civilizations as medicine, with recorded use being by Hippocrates in 400 BC in the form of tea to provide relief to women during childbirth. It wasn't until 1899 that aspirin came into the form we know it today, when a chemist named Felix Hoffmann discovered the chemical compound salicylic acid from the willow bark and went through a series of extractions and purifications to result in the compound acetylsalicylic acid, or ASA, the primary acting agent of aspirin. Of its many uses, one that is commonly known is aspirin's use to prevent a heart attack, or at times when a heart attack is occurring. In an emergency situation where a heart attack is suspected, the first thing a 911 responder will tell you is to give the person having a heart attack aspirin. But why exactly is that? To understand this, first we must understand how a heart attack happens. A heart attack happens when blood can't reach a section of the heart, preventing oxygen from reaching that part. If blood flow isn't restored quickly, it's very possible that that part of the heart can get damaged or die. Blood flow to the heart can stop when the blood vessels taking blood to the heart become obstructed. Coronary artery disease is a condition in which over time a thick substance called plaque develops in the walls of arteries due to genetic and lifestyle factors. This plaque causes the passage of blood in the arteries to narrow, which makes it harder for blood to go through. When a lot of plaque builds up, it can eventually rupture in the artery and cause a blood clot to form inside the actual artery. This blood clot can grow, and as a result, it can cause an obstruction of blood leaving and entering the heart. This is what results in a heart attack. Blood clots form when a component of our blood called platelets start to stick together. These are the same clots that form when we get a cut. In a heart attack, however, these can be deadly. Aspirin works by acting on the platelets to stop them from clotting, thereby slowing the clot from getting any bigger during a heart attack and actually making it smaller. Let's discuss the mechanism by which this happens. To understand this, we must understand the structure of aspirin, also called acetylsalicylic acid. This compound contains a chemical group called acetyl, which is involved in acetylation reactions, where the group is transferred to another compound. Aspirin works in two major ways to prevent blood clots. First, let's understand that a component called COX-1 activates platelets and also leads to the formation of thromboxane, which causes the activation of more platelets and promotes clotting. Aspirin inhibits the formation of COX-1, which thereby results in lower production of thromboxane. The other way aspirin works is by transferring its acetyl group to proteins that are involved in the process of blood clotting in the body, such as fibrinogen. This is important because it stops the action of fibrinogen, which would otherwise bind to the platelets and strengthen the blood clot. These actions of aspirin cause an irreversible dysfunction in the clotting of platelets for their lifetime. This lifetime, which is about 8 to 10 days, basically prevents blood clotting. You can see why this is important when a heart attack happens, because it greatly reduces the impact of the blood clots that prevent the blood flow to the heart. Many people use aspirin in low doses as prescribed by their doctor to prevent heart attacks. After a heart attack, patients are often prescribed aspirin daily, sometimes for the rest of their life, just to maintain blood flow and prevent future heart attacks. The antithrombotic property of aspirin is also life-saving in instances of a clot-related stroke, also called an ischemic stroke, where blood flow to the brain is disrupted and can lead to death. On the flip side, using aspirin during a hemorrhagic stroke, where blood flow to the brain is disrupted due to a blood vessel in the brain bursting, can prove to be fatal. Aspirin should not be used by people who have ulcers, bleeding disorders, gastrointestinal bleeding, kidney problems, liver disease, among other conditions. Because aspirin works as a blood thinner, its use in conjunction with one of these conditions can lead to uncontrollable bleeding and severe blood loss. Although aspirin has life-saving properties, it can also lead to fatal side effects if not taken in the correct dosage and in the correct situation. While it is important to have aspirin present in your house in case an emergency occurs, it is also important to be educated about when and how much to take. For these reasons, please see a doctor before taking any type of medication, including aspirin.